Senator Shaheen next. Oh, good, even better. Ladies first.
You know, we do everything in the Senate in order of seniority. So my friend, Senator Merkley, is kind enough to recognize that I have more seniority than he does. So thank you, Senator Merkley. And thank you, Senator Wyden and Senator Lujan, for all of your excellent work and for the effort to ensure that all Americans have access to affordable health care when they need it. You know, I want to speak just to the enhanced premium tax credits that are going to expire at the end of this year, because what did not happen when our Republican majority passed the reconciliation bill is they did not extend those premium tax credits. And refusing to do that means that health care coverage is being actively taken away from families who really need the help. It means raising costs for millions of Americans at a time when they're already struggling with increased costs. And that pain, as Senator Wyden said, is being felt almost immediately, because insurance companies are looking at having to submit their rates, and they are increasing their rates. Premiums will increase for 20 million Americans. A typical family of 4 will see a $10,000 increase when those premium tax credits go away, and a typical 60-year-old couple would see a $17,000 increase. So think about that. Parents, grandparents are going to see $17,000 increase. And because of those increased costs, Americans are going to lose their health care coverage. The nonpartisan data shows us that 4 million Americans will lose their health care. More than 1 million of them suffer from chronic illnesses. So if they don't have health insurance, who's going to pay for that coverage to make sure they get their treatment? Well, everybody's going to pay for it. And that's on top of the unprecedented health care cuts to Medicaid that were passed as part of that bill. I heard from one of my constituents, Jen, from North Conway, New Hampshire. North Conway is a small community in the eastern part of New Hampshire. Her story, I think, shows just how important these tax credits are, because Jen was diagnosed with leukemia. She started getting chemotherapy to treat it, and she was able to, because of the Family Medical Leave Act, she was able to take time off from her job for 3 months. But then, because FMLA ended, she lost her job. And when she lost her job, she lost her health care coverage. Her husband had to act as her caregiver, but then he had to go back to work, and his employer didn't provide health insurance. But the way Jen was able to continue her chemotherapy was because she and her husband were able to afford health insurance under the Affordable Care Act because of those premium tax credits. They lowered Jen's premiums by $700 a month, and they allowed her to continue her chemo treatments. And look, when the reconciliation bill was debated and we saw the tax breaks for the wealthiest and the big corporations, a lot of our colleagues on the other side of the aisle didn't think $700 a month was very much money. But I can tell you, for Jen and her husband, $700 savings each month, $8,000 a year is the difference between being able to continue to have the health care they need, continue to put food on the table, continue to pay their rent, and losing all of that. But most important, the tax credits were there when she needed them, when she got sick, when she could no longer work. So the clock is ticking. We first introduced the legislation on this issue back in 2019. We've secured temporary extensions that have helped fuel record enrollment in the Affordable Care Act. But we're approaching another deadline, and we need to take action now to permanently extend those tax credits and to end the back and forth every year that people know, so people know they can count on them. So thank you all.